Crazy. Grapefruit juice. It interacts with a lot of different drugs, right? But you guys have to know what happens. Generally speaking, when you digest food or anything you consume, in particular drugs, right? You have the active ingredients of the drug. You have something called the first pass. The first pass is when you take something GI tract enterally, you take it in here, and it goes through your intestines, and they all get absorbed through the liver, and they all go to the liver. Now, the liver deactivates, which means that it has a full. Let's say you take Tylenol, right? Acetaminophen, and that's not one of the drugs, by the way. But you take a drug, and it's supposed to be broken down so we can expose the useful metabolites, I mean the useful substances for drugs, so it can have its effect on our target tissues. My point is that when you consume some drugs and you're also taking grapefruit juice, that grapefruit juice does two things. It can block an enzyme, CYP3A4. This is an enzyme that helps us break down the chemicals of the drug. And as they get broken down, they can be sent to the bloodstream so our kidneys can excrete it, right? Grapefruit interferes with that ability, with this enzyme. It interferes with the enzyme that helps break down the drug. So if you cannot break down the drug, then that drug stays in your system much longer, and it's going to potentiate that drug or cause toxicity. Does that make sense? Some of those drugs are amiodarone, buspirone, the statins like simvastatin, anti-cholesterol drugs, right? What's this one? Alprazolam, Xanax, right? So these are some examples of medications that can become toxic because the grapefruit juice blocks the enzyme that helps break and excrete that medication. Does that make sense? On the other hand, grapefruit juice also interferes with something called transporters. The transporter is also an enzyme that helps take that drug and send it to the target tissues, which means it allows them to have the therapeutic effect. Well, grapefruit juice also interferes with the transporter. So in some drugs, it can also decrease the effects of the drug because we need that transporter to get that drug so it can have its therapeutic effect throughout the tissues. Does that make sense? But if you're drinking grapefruit juice and that particular drug, like fexofenadine or I think that's Allegra, what ends up happening is that drug is not going to have its therapeutic effect because grapefruit juice also interferes with the transporter that takes the viability of that drug and sends it throughout the systems, the tissues. Does that make sense, guys? So that's the issue with grapefruit juice. It interferes with enzymes that help utilize that drug or excrete it. And so in most of the cases, it's going to increase the effects of the drugs. It's going to cause toxicity because it interferes with that enzyme. And in some cases, like in this one, it'll decrease the effects of the drugs because it cannot be transported to the